everyone, and welcome to Athena Pelvic Therapy's Facebook page. And if you are watching on a different page, you might be a little confused. Don't be, because we are also streaming on Pelvic Rehabilitation Medicine's page at the same time, and we're so happy to partner today with them. What we're going to be doing today is I have Dr. Jana Scrivani with me, and I'll introduce her a little bit in just a second, but we're going to be talking about something that's super relevant today, and that is anxiety and pelvic pain. During this quarantine, pandemic, craziness that we're talking about right now in this world, there's a lot of anxiety out there. And, some people think that it really does increase your pelvic pain, and some people think it doesn't have anything at all to do with it. But we're going to get to the bottom of that today with Dr. Scrivani and talk about a lot of different items. But first, I want to welcome you to the very first of what's going to be a weekly live stream for Athena. And it's going to be a monthly live stream with Dr. Scrivani. And so I'm so excited about that opportunity. Today, we're going to talk specifically about how our brains and our bodies connect. What is it about our brain that can make our pain seem worse? And then we're also going to talk about anxiety and how that anxiety does play a role in pain. But something that's super important and you really want to stick around for till the end of this broadcast is that both Dr. Scrivani and myself are going to give you strategies and techniques that you can use today to help reduce your pelvic pain. And that is definitely worth staying around for. Now, like I said, we're broadcasting on both Athena Pelvic Therapy and Pelvic Rehabilitation Medicine Facebook pages. And we're going to be here quite often, at least once a month for Dr. Scrivani and myself. So if you wanted to be here when we are here and you want to be live so that we can see your comments and answer your questions so that you can be part of this live broadcast, then go ahead and like our pages, Athena Pelvic Therapy and Pelvic Rehabilitation Medicine. For some reason, I keep wanting to say pelvic health rehabilitation. It just rolls off the tongue that way. But Pelvic Rehabilitation Medicine pages. That way you are going to be alerted every single time we go live. There's also a way you can be alerted if you click on the video. There are the little three dots up in the right hand corner. You can click on that and hit the enable button, and our beautiful faces will appear every time we are on Facebook Live. So that is what you can do so that you're with us the whole time. Now, of course, I want to welcome everybody who's watching us, whether you're live or possibly on a replay. Go ahead and type in the comments, hi, introduce yourself. We're happy to get to know you, and we look forward to any questions or comments that you have coming in. We want to make sure that we're addressing those as we get a little bit later in the show. But today, we're really going to address the problem or the question of anxiety and pelvic pain. Is it real? First of all, does your anxiety or stress level increase your pelvic pain? And if so, what is it that we can do to make it better? And again, joining me is Dr. Scrivani from Pelvic Rehabilitation Medicine. She is a psychologist and cognitive behavioral therapist. I'm so excited to have her here. She's been working with people experiencing pelvic pain for the last 3 years. And I know she's a huge resource that we've only met a few weeks ago, but it feels like we're already best friends. I've already been talking her up because I'm so excited to have her here. But Dr. Scrivani, I want to ask you a quick question. Not a quick question. We've got all the time in the world, I suppose. We don't have advertisers coming up or anything. But I want to ask you this, because a lot of people now are saying that they are experiencing much more pelvic pain since we've been in this lockdown quarantine situation. What are you experiencing? What are your thoughts on that?
So I would say, absolutely, right? The mind-body connection is incredibly strong. And that's one of the things that we're really going to spend some time talking about today. So it is really actually quite a normal experience that excess amounts of anxiety and stress can have an impact on our bodies, and specifically have an impact on our pain levels. And the pelvic floor is no exception. So if that's an area where you've experienced pain before, it's certainly likely that anxiety and stress will contribute and potentially increase your experience of pain. Particularly, we know that stress and anxiety increase pain, and then pain increases stress and anxiety, which I'm sure is not a surprise to anybody out there. And then what we talk about, right, is it can become this kind of vicious cycle.
Mm-hmm. Yeah, that's true. And it doesn't look like our anxiety levels have any chance of coming down anytime soon, because even if we do get out of this lockdown or quarantine or whatever you want to call it, just the anxiety of going back to life and back to whatever normal is going to look like at that time. I mean, that is going to really play on us for a while. So this is not just a short-term solution. This is something that we're going to need to look at for a long-term strategy in order to be healthy. Let's go ahead and get into it, Dr. Scrivani. And I want to explore a little bit, if you would, what this whole brain-body connection looks like. What is it that our brains do in order to contribute to this idea of pelvic pain that we have?
Yeah, it's such a great question. And I think part of the reason why I am so invested in getting this message out there is that so many people who come to me with pelvic pain at some point during their journey have gotten the message, this pain is all in your head. And so I always want to get ahead of that statement and put this out there, that when we're talking about the mind-body connection, we're talking about pain that's real. So just because we're going to talk about how your brain influences your perception of pain, right, it's in no way to suggest that the experience of pain is not real. It absolutely is. But the more you know about how your brain impacts the way you experience pain, I find that to be a really empowering place to come from. So for a moment, let's just go backwards in time and look at how we used to think about pain. So it used to be that we looked at pain in a very specific way. In fact, the name of the theory was called the specificity theory, which, very simply speaking, would argue that, let's say, if I broke my arm and you broke your arm, that we would both experience the same amount of pain, right? Specificity equals tissue damage equals pain. And we know for a variety of reasons that that's just not enough to explain people's pain. We know that despite injury, two different people with two similar injuries can experience very different pain levels. We know that people can experience phantom limb syndrome, right? So pain in limbs that are no longer there. So something else is responsible for influencing our perceptions of pain. And one theory that explains that is a theory called gate control theory. So gate control theory, slightly more complicated theory of pain. But what that tells us is that when we experience pain in a certain part of our body, let's say, again, due to an injury, like, for example, if I put my hand on a hot stove by accident, that's sending a signal that goes along my spinal column to my brain. And then my brain sends a signal back telling that part of the body to feel pain, which is a good thing, right? Because I don't want to rest my hands on a hot stove. That pain signaling is telling me, okay, Jana, you need to do something about this and move your hand. What gate control theory tells us is that the pain that we experience, our brains play a role in mediating that response. So what I mean by that is that these gates, right, these kind of metaphorical gates exist along our spinal column. And there are certain things that can open those gates and increase our sensitivity to pain, increase the pain. And there are certain things that can close the gates. And certainly, right, we know that injury or certain types of activities can absolutely be gate openers. But I think what people are less familiar with are that negative thoughts, negative emotions, right? Those can also be gate openers. not having sufficient social support, right? Which is definitely, I think, becoming a larger and larger issue as people spend more time at home. So not having that social support can serve to open those gates and increase pain. Excess focus on the pain is one thing that can also serve to increase those gates. And I think something that also applies specifically to the situation that we're in now with social distancing and quarantining rules, right, is that a lot of people now have more time on their hands, and more time might equal more focus on the pain, which then serves to increase the pain. So when we talk about that mind-body connection, what we're really trying to do is to limit those things to the best of our ability that open the gates, and to increase those things, right? Those things in our lives, like positive thoughts, positive emotions, positive social interaction, that tend to have the opposite effect, that can actually serve as gate closers and decrease our pain.
Okay. Sorry about that. I was so into what you were saying. I was like, oh. So,
thank you, very flattered.
It was great. All right. So that is really great information to know. I know a lot of people, and it's not just that they hear people say, "Oh, it's in your head." I mean, if you go to, medical professional after medical professional after medical professional who can't find something wrong, then you begin believing that it's in your head, and it can be a very frustrating issue especially when you're dealing with pelvic pain, which is something that you can't point to and say, "Oh, it's right here."
Absolutely. And then if somebody refers you, let's say, for cognitive behavioral therapy, the message you might hear is, "It's in your head," right? Rather than, actually, there are these changes that we can make that actually change the way your brain signals that you're in pain.
Right, exactly. And on that note, I'd like to add a little bit to that. And what I'm going to talk about really is that once our nervous system gets turned on and it is sending those pain signals to your brain, exactly what Dr. Scrivani was talking about, when those pain signals get sent to the brain, well, it doesn't just go in one direction, but then the muscles start to react. So maybe there was nothing wrong with the muscles before, but now there's this pain sensation like, oh, maybe there should be something going on in the pelvic floor. And then our pelvic floor muscles and some of the muscles around our pelvic floor decides, oh yeah, something's wrong. And then it starts to contract and it becomes very tight, because our muscles only know how to do two things, and that is to contract and relax. And whenever there's stress or anxiety or any kind of threat to ourselves, what happens is they go into this defensive or protective mode, and that is a contraction. The problem with that is sometimes it gets stuck. And even though maybe the stressor is removed, those muscles stay in that position. So whether it's a physical stressor or an emotional stressor, your body is going to react pretty much the same way, which is to contract and to stay that way. And specifically when it comes to pelvic health, when we're thinking about all of the emotional components that come into play with regard to that pelvic floor, it doesn't take much, especially if you're experiencing pain, for those muscles to contract. And then, like you said, Dr. Scrivani, we've got this ugly cycle that happens. So maybe the pain signals get sent up to the brain and there's nothing happening as far as the pelvic floor contracting. But once those pain signals start, then the pelvic floor starts contracting, and now we have this pain in the pelvic floor that is sending pain signals up to the brain along with the other pain signals. Now we have more anxiety, more pain, more anxiety, more pain, and it just continues on and on. So it is a serious issue. So even though it may have started in the mind, even though that doesn't mean it's not real, like Dr. Scrivani said, but even though it may have started in the mind, now there can be these physical representations of what's going on too. The great news is, though, and this is why it's so great to have someone like you, Dr. Scrivani, on here, is that we can help to control some of that when we start to control our thoughts and ideas. And I think now is a really good time to talk about our second point, which is that even, right now, at the time of this broadcast, we're in a weird time. Of course, this is so oversaid, but we're in unprecedented areas, right? Nobody who's living right now has ever had to live through this, and so we're so confused. And I would like for you to talk about, how this quarantine situation, how this, even if we weren't in quarantine, just the threat of this COVID-19, how that can lead to these anxieties, which might increase the signaling that you were talking about to our brain.
Sure. So I want to almost go back, to the point, Dr. Benedict, that you made earlier, right, about our nervous systems and how they react under threat. Because I think what's happening on a mass scale right now, ever since we first started reporting, and learning about COVID and that it was spreading, in our communities, let's say here in the United States, is that our bodies are reacting constantly as though we're under threat. Because if you think about it, it's kind of like the perfect storm of you're being told, hey, there's something going on, there's something dangerous. We're not exactly sure of all the information about this. We're not exactly sure when this situation will end, and we're not exactly sure how it's going to end. So that uncertainty, right, fuels our anxiety response, and living under the sense that we're constantly under threat activates our body's fight or flight response, which would be really fantastic. If there was a tiger chasing you, you would be all set. But unfortunately, right, our responses right now, the most appropriate response is, we're being told to stay in our homes, decrease a lot of our outside activities. So then what we're left with are the symptoms of our fight or flight response. Right. So what we have is an ongoing release of stress hormone, for example, cortisol. We have increased blood pressure, increased pulse rate, all of these physiological responses that happen when our bodies believe that we're under threat. And that's now going on for a very, very prolonged period of time. So what I'm hearing from a lot of folks, the two most common physical complaints I'm hearing is I'm in more pain. So I'm experiencing more pelvic pain or more pain in general, right? Increased headaches, increased stomach distress, and exhaustion, right? People are asking, why am I so tired? I'm not commuting to work, every day anymore. I'm sleeping for 8 hours a night. Why am I exhausted? And there is a very valid reason why you're feeling more susceptible to pain, more tired. And it's because of this constant stress that your body is experiencing in the form of your fight or flight response. Additionally, right, all of the things that we generally have in place, both to manage anxiety and to manage pain, have been significantly curtailed right now. So, for example, I may have had a really great pain management routine before this. Let's say, I woke up, I did a certain amount of exercises, got my kids off to school, went to work myself, then maybe had physical therapy after work. And there has been a significant disruption both in everybody's day-to-day routines have been kind of turned on their heads. What we're expected to do, even though we're experiencing all of these enormous external stressors, a lot of the demands on our time have actually increased. So whether it's trying to be productive working from home while also managing children and homeschooling and just the day-to-day stresses of living under these quarantine lockdown situations. And then our supports are not as accessible. So for people specifically with pelvic pain, you might not have been able to access physical therapy appointments. Treatment plans such as injection series and things like that you may have been counting on, right, to look to some pain relief, and a treatment plan may have been postponed or canceled. And going back to gate control theory, a perceived sense that we have control over the pain or that it's somehow predictable decreases our pain. And feeling that uncertainty and loss of sense of control over our pain can really serve to increase pain. So that anxiety and stress that really are pretty directly related to all of the things going on, in quarantine and lockdown right now are having very, very real physical effects in terms of increased pelvic pain.
Yeah. And something that I know people feel a loss of control with is like just their body movements in general. So exercising. There's so many benefits to exercising, and I want to talk a little bit more about that. As a physical therapist, that's clearly something that's super important to me to get across to people. And I think you made a very good point when you said that, people do not have access to the therapy that they normally did. Like a lot of physical therapists were shut down, and especially pelvic floor physical therapists, because we really get into very interesting places. We weren't allowed to operate necessarily under the same rules or the guise that we were before. And a lot of people had to go without their treatments. But even without the physical therapy pelvic floor treatment, just regular exercising, we weren't even safe whether or not to know whether or not we could get out to go for walks. And depending on where you live, it still may be something that you are kind of risking to get out and go for walks or to do any kind of exercises. So even if you did have a normal exercise routine in the beginning, before all of this started, it's very likely that exercise routine has at least been somewhat disruptive. I know for myself, I liked to go to a gym, and I really enjoyed that because that was my exercise time. That's when I had my exercise hat on, and it was just set aside for that particular purpose and time. But then when the gym closed, it was really hard for me, not just to physically do it, but to get motivated to do it, because now I had to modify everything and do it in my house, and I had to figure out what worked for me. And I'm still struggling with motivation. But the important part about exercise is that, first of all, it does help us to relieve our stress. It does give us something that we can control within our body. Because oftentimes when we have pain somewhere, anywhere, but especially in the pelvic floor, you do feel out of control. But doing exercises does give you the power of control over your body. And you can also have the power of movement, which is so important. Remember, before I was talking about how when you're stressed, our body will tend to tighten up. And it doesn't take much for anybody to understand how that works, because think about it. If you're stressed, all you got to do is just feel your neck muscles and you're going to feel tightness, or maybe your jaws clench. And that's where that tightness and those contractions come in. Now, the great thing about exercise is that when you start to move, those muscles are forced to relax in a good way. I shouldn't say they're forced to relax. They're forced to work the opposite way. So it's not like doing a stretch until a stretch hurts. You should never do that. You should never force your muscles. But instead, if you work your muscles and you have a good exercise routine, then your muscles are going to respond in a natural way that they're supposed to respond, and they're going to be able to relax in the way that they should relax. So you don't have to force it. Instead, you can just work it the opposite direction. And that's why exercise is so important. Now, with regard to pelvic pain and exercise, I understand that some of you with pain, you just don't even know what's safe, what's not, what hurts, what doesn't hurt. If you've been in physical therapy before for your pelvic pain, I advise you to continue to follow the advice of what your therapist has recommended. Otherwise, let your body lead you. Let your body lead how much you can push yourself, or maybe how much you can need to scale back. Because every day is different, and that is okay. One day you might be able to walk a mile, and the next day you may only be able to walk a block. And that is okay. You just have to accept where you are and congratulate yourself for getting out, because you're taking control of your muscles, you're having them to work properly, and that is a huge start, and it's so important to be able to do all of those things. So I think it's really great how the mind and the body interact together to really create this, person that we call us, so that we can do what we need to do to get through life and to get through the day. Dr. Scrivani, I would like to know if there's anybody out there who's watching us or listening to us, if you guys have any comments or what your experiences are. Have you experienced a disruption in your exercise routine or in your self-care routine, as Dr. Scrivani was talking about? What is it that what's your experience been like? Feel free to type something in the comments. You can message either of the pages if you would like, pelvic or Athena Pelvic Therapy and Pelvic Rehabilitation Medicine. So feel free to message us if you would like. But I would love to know. We think we would both love to know what your experiences are or have been, and what you've done to try to move forward in this time. Dr. Scrivani, I would love to look at some of the comments if we can. I can't see your comment, so are you able to see? Has anybody asked any questions or anything? Maybe not. It's okay.
We have a hello.
Yes.
Nikki. Hi, Nikki.
Hi, Nikki. Nikki, is that who you said?
Yeah.
Hi, Nikki. How are you? Well, Kathy definitely has been asking. She's been helping us through like our technical issues, which is great. So we appreciate that, Kathy. Thanks a lot.
Well, thank you, Kathy.
Yeah, exactly. First time doing something live, we don't quite know exactly what kind of technical issues other people can be experiencing. So we appreciate any kind of feedback that we have. So I think it's great that we got to talk about like the brain-body connection and how important that is to our health, and this idea that we're going to be anxious for a while and working on, and it's okay to try to figure out what that new normal looks like for you. I think now we should really start to look at giving people some real advice as to what they can do on a daily basis or weekly basis, or just incorporating it into their lives to help to reduce their pain, whether it's through your techniques or my techniques. So I would love to hear, because I've heard a lot of people, like I said, now say that, their pain is much worse, whether it's pelvic pain, back pain, knee pain, it doesn't matter. And there have been a lot of techniques thrown out there for stress relief and for pain relief. And I would like to, but there are some techniques that are surefire wins, and they're not damaging, that they can really be helpful. So what I would like to do is just provide our listeners with some of those techniques that they can use and implement today, so that we can provide them with a lot of good information. And Dr. Scrivani, I love the one that you're going to share right now. I think it's probably the core of what we're going to do. So what is it that is your takeaway that I think is amazing?
Great. So in a moment, thank you for the build-up. I'm going to talk about diaphragmatic breathing, but we do have a question. So the question is, hi, do you have any recommendations, techniques on dealing with problems in the rectum, such as lasting pressure on the rectum and a feeling that it is constantly open and under pressure? From, I hope I'm pronouncing your name correctly, I apologize if I'm not, from Ghazal.
Okay. So the rectum is part of the pelvic floor for sure, and it shares muscles with, what was the name again? Ghazal. Okay, so it shares the muscles with the vagina or penis, like the entire pelvic floor there. So the idea that the rectum is tight is an indication that there's some kind of dysfunction happening on the pelvic floor at the muscular level. Now, there could be other issues that are happening. It's definitely hard to give you specific advice because I don't know a whole lot about what's going on. If you have not sought out a pelvic floor physical therapist, even just for a consultation to where they get to know a little bit more about your background and your history and what's happening, because there may be something physically internally that's going on. There may be something externally that's going on, but there needs to be a little bit more of expansion of knowledge before we can provide like specific advice. You can always message me and I'll be happy to dig a little bit deeper into that if you would like that. But the question is, what was the question again? I'm sorry.
Sure. So the question is recommendations, techniques on dealing with problems in the rectum, such as lack of pressure and feeling it's constantly open or under pressure.
Sure. So typically sometimes people will use trigger point therapy, which is finding those tender spots and doing this technique that can help. But this is why a broader understanding of what's going on is important, because if you try to apply some of these techniques, it can make things worse. So we have to know what's going on and what really is your issue before we can determine which technique works for you. There are lots of stretches that are not going to make things worse, and we're going to talk about one of those in just a minute. But if you're familiar with child's pose, that's something that can definitely help to open up. You don't want to push it. You don't want to make it too painful, but I'll talk a little bit more about what you should feel in a bit.
And a great segue into talking about diaphragmatic breathing. Wonderful comment from Nikki. I think I keep realizing I have to come back to center. Like when I get off track, I just have to bring it back in and reach into my toolbox and start over. And I love the way you ended this, and that's okay. And so I really hope that this will be an exercise that might make it into your toolbox. So it's diaphragmatic breathing or belly breathing. And before we go into the actual technique, I always like to talk about rationale. So anybody who's ever worked with me, anyone who's ever taken the class that I teach on pelvic pain, which I'll talk about at the end of our live today, knows that if I ever ask people to do something, I'm always going to give you a really good rationale for why I'm asking you to do that. So when we're talking about this ongoing stress, anxiety, or fight or flight response, increased pelvic pain, there are certain reasons why diaphragmatic breathing can be a really, really helpful exercise. So if you think about it, we're all walking around at a much more elevated baseline anxiety than we're used to. So, for example, let's just say that since, for the past 2 months, right, since most of the lockdown orders have been going on across the US and across the world, let's say you've been walking around perpetually set at a 5. And then let's say your child throws a tantrum, which would normally ratchet up your anxiety by an extra 2 points on this 1 to 10 scale, right? So now we're talking about anxiety at a 7, which is pretty elevated anxiety. Now, if you were walking down, let's say before all of this, permanently set at like a 1 or a 2 as your baseline, that tantrum isn't going to bring your anxiety into the red zone where your anxiety feels more difficult to control. But because we're already kind of elevated, our anxiety is spiking, higher with things that we feel like we maybe used to be able to handle more easily. More specifically, when it comes to our body's fight or flight response, diaphragmatic breathing helps bring our bodies again back to baseline, back where our bodies like to be. And it's also a pain management technique. So, for example, as we grow, as we get older, we change the way that we breathe. So if you're ever to watch, babies or kids sleeping, young kids, you'll notice that their chests aren't rising and falling so much. Their bellies are. It's kind of the natural way we breathe. But as we get older, our breathing shifts breaths and we start to take more shallow breaths into our chest. When we're in pain, right, that can increase and we start taking more rapid, more shallow breaths into our chest, stresses our body, increases your pain response. So this breathing technique on a several-fold level, it can help lower your baseline anxiety. It can be used to manage in the moment anxiety and stress spikes, and also to manage pain and pain flares. I'm also sure that when I'm done, Dr. Benedict can talk more about the muscles involved, because your diaphragm muscles are so intimately connected with your pelvic floor muscles that this exercise can also help to relax them. So the first thing that I want you to do if you're practicing along with us at home, wherever you are, is just first notice. As you're breathing, see if rather than directing the air into your chest, you can direct it into your diaphragm. If you don't know where your diaphragm is, it's basically, right, it's in your stomach muscles. It's behind your belly button, where you'd want to breathe if you wanted to belt out a song or scream really loudly. So I just want you to practice seeing if you can redirect that breath into the diaphragm, almost as though you're inflating your stomach like a balloon every time you breathe in, and deflating every time you breathe out. And once you feel like you're successful at getting the breath into the diaphragm, which can take a little practice. So if you're having trouble, it's often easier first to do when you're lying down. So you might want to practice the skill until you master it while you're lying down. Sometimes it's even helpful to put little markers, like take a Post-it and stick it on your stomach and watch it rise and fall. Maybe gently, very gently press with your hand and practice pushing your hand up with each in-breath. And once you've successfully gotten the breath into your belly, you're going to slow that breathing down. Probably the slowest you've ever breathed in your life. So you're going to be breathing in for a very slow count of 4, pausing for 1 second, in through the nose, and breathing out through the mouth for a very slow count of 5. And it actually is important that your out breath is slightly longer than your in breath. It allows you to take a full deep breath next time. And it also helps to activate your parasympathetic nervous system, which is your nervous system, the part of your nervous system that's responsible for calming everything down. So this is how slowly you're going to breathe. It's going to feel something like this. So you're going to breathe in, 2, 3, 4, and pause. And out, 2, 3, 4, 5. And this skill, while it sounds pretty easy, really does take practice to master. So it's really common when you're first getting into the groove to almost feel maybe like you're not getting enough air. You might feel more anxious when you first start because you're paying more attention to your breathing than you have before. And all of those are very normal reactions, and they don't mean the diaphragmatic breathing isn't going to be helpful to you. What it does mean is that I strongly suggest that you practice at times when you're feeling less stressed or when you're in less pain, because the more you master it when you're less stressed and not in the midst of a pain flare, the better able you're going to be able to use it as a skill to both manage anxiety and stress, manage pain, and then manage that vicious cycle that we keep talking about.
I don't even know if I can talk now because I'm so relaxed after doing that.
My work is done.
You're done. I cannot agree with you any more than, it's something that I try to teach people too, but it's so critical to be able to breathe properly, to calm that nervous system. I mean, you were just totally on point. And thank you so much for going through what that is going to look like for people. And it's hard. It's hard to slow down and to breathe and to just let everything kind of relax. That is a skill that's learned. And that's amazing. So what I want to do too, and just as a brief tangent, is you're right, your pelvic floor and your diaphragm are very related, so that they have this symbiotic relationship. So as your diaphragm is moving, so is your pelvic floor. So if you're breathing those nice deep breaths, you're actually stretching and relaxing that pelvic floor while you're breathing. So if you have not learned how to breathe the way that Dr. Scrivani just talked about, it is something that is worth doing. And if you missed it, this is going to be on our Facebook pages. It's going to be on YouTube. So make sure that you go back and listen to it again and again and again and again, however many times you need to. And she has a video, actually, right, about this specific thing. And she can link it. She can put it in the comments. She'll put it with the Pelvic Rehabilitation Medicine, and I'll grab that link too and put it on my comments. So we'll have it on both pages. That way you'll have access to it and you'll know exactly where to go so you can get that information. So my tip is a little bit different. Also important, as my theme throughout has really been talking about how our muscles contract when we're stressed. And after you do your diaphragmatic breathing, just as Dr. Scrivani just described, what I would recommend then is to take some time and to stretch your muscles. Now, specific muscles, actually. When we get stressed and we have pelvic pain, actually pelvic pain, abdominal pain, and even back pain and hip pain can be related to these muscles that are on the inside of our thighs. They're called our adductor muscles, ADD, adductor muscles, and they're responsible for bringing our legs together. So even people who have problems with urinary incontinence and pelvic pain, those are some of the muscles that are some of the tightest in your whole body, because it's a defense mechanism for our bodies to employ. Now, oftentimes when we release these muscles, it also helps to release the muscles that are supporting that. So it helps to relax the hip muscles, the back muscles, and definitely the pelvic floor muscles a little bit. Now, it's funny because yes, these muscles are not directly part of the pelvic floor, but if any of you are in pain, you know that the pain that you experience in your pelvic floor doesn't just stop at your pelvic floor. So what we're doing is we're actually working backwards. We're working with the muscles that are affected by pelvic pain so that we can then turn around and change that pelvic pain. And to stretch the inside of your thighs, there are lots of techniques. All of them are pretty simple. The easiest one that I would suggest that you do is go ahead and have a seat on the floor. The floor is the easiest place to do it. If you can't get onto the floor, then you can grab an ottoman or another chair, something that you can put level with your hips though. So you don't want it to be too high or too low. You want it to be level with your hips. And as you sit, hopefully I'm going to say on the floor because that's the best position if you can get on that. As you sit on the floor, you bend one knee, so you bring your foot along the inside of your opposite thigh, and then you just straighten the other leg. Now, when you straighten the other leg, it doesn't come straight out in front of you, but rather it goes at an angle. And once you get that leg at an angle, you'll start to feel a little bit of a stretch on the inside of your thigh. It's going to go all the way from the inside of your groin area all the way down to probably your knee. And that's normal if you feel it all the way to your knee. There's nothing wrong with your knee. It's just that these muscles are connected in those areas. And so as you stretch them, you're going to feel it all throughout your inner thigh. Now, sitting in that position may be enough, and you may feel a stretch. With any stretch, you want to make sure that you're breathing deeply and softly through the stretches and really feel what's happening. Don't be afraid of the stretch and don't force the stretch. You want to maintain it for 1 minute. So if you start a stretch and you're hurting yourself, you're not going to be able to hold that stretch for a minute. Plus, you can actually damage the muscles. And we don't want that to happen because that's only going to increase your pelvic pain. And we're trying to do the opposite. So what you need to do, get into the stretch to where you feel a slight discomfort. So on a scale of 0 to 10, you should be at maybe a 2 or a 3 pain level, okay? Or not even pain level, discomfort. So as the stretch goes on, as the minute progresses, and a whole minute, and it's hard to keep track of a whole minute, so you either want to set a timer on your phone or you want to set some kind of a reminder for 1 minute so you know when that 1 minute is over. But as that minute progresses, your muscles are going to start to loosen up. And as they start to loosen up, you can lean forward just a little bit. As you lean forward, you're going to have a more intense stretch. And you can do that the entire minute. Now, at the end of that minute, when you come back up to a nice neutral sitting position, just be gentle with your body. Don't just throw your leg back in. Be gentle. Give your body some time to recover from the stretch. And then, like a second or two, just pause and then move on to the other leg. So by alternating legs, you can do 2 sets. That means just do it 2 times, 1 time on each leg at a time, holding it for 1 minute. And you're going to notice a huge change in the way that your legs feel. And hopefully, a lot of stress will be relieved from the pelvic floor as well. But that is my tip for you to take home and to work on, is just that stretch on those inner thighs. So that will be good for you to do that. So now we've got 2 things for you to work on. We have the stretching of your inner thighs, and then of course we have the diaphragmatic breathing. And they actually both go together very well because they're both meant to calm the nervous system. And that's so critical in pain, just as Dr. Scrivani talked about earlier as the theory of how pain works. So, wow, we've had a good conversation, don't you think?
This has been super fun. And full disclosure, I'm already wearing my sweatpants. So I'm in a perfect position right after we end this. I'm going to go get on the floor, do some stretching, do some breathing, calm my nervous system. I hope that the rest of you will do something similar.
Absolutely. I'm not in my sweatpants. I actually did put on pants today. So but believe me when I tell you that my sweatpants are close at hand. They're never too far away. So I can certainly grab those and get started doing that. So I think we're gonna wrap up now. But before we go, I want to again invite you to like both of our Facebook pages so that you will know the next time that we go live. Again, I am Athena Pelvic Therapy. My name is Dr. Juanita Benedict. I'm a doctor of physical therapy. And then we have Dr. Jana Scrivani with Pelvic Rehabilitation Medicine. So go like both of those pages so that you have lots of information. Also, Pelvic Rehabilitation Medicine has a great presence on Instagram. I am just now starting Instagram, so if you like scrawny Instagram accounts that are growing, you can go and like mine. But Pelvic Rehabilitation Medicine has a good presence on there, and definitely you can go on there to get lots of good updates and information about how to take care of your pelvic health, as well as just your general health too. So I think that's all we have today. Thank you so much for being here. I cannot wait till next month when we do this again.
Me too. This has been really fun. And yeah, I'm looking forward to making this a regular thing. And feel free to leave comments, talk about things that you might be interested in hearing the two of us discuss.
Yes, absolutely. Because really, we're designing this for you. So whatever questions you have, whatever concerns you have, if there's anything that you want us to answer or explore, we are so happy to do that for sure. I can't wait to see what comes in. And if you leave any comments or questions and we didn't actually get to you, we will. After we get done with this, we'll go and do some typing and make sure everybody gets answered pretty quickly. I think that's it. I think we'll put out events. We'll let people know when we're going to go live next time, and I'm very much looking forward to it.
Bye, everybody. Thank you all so much for watching and listening.
Absolutely. And remember that even during this crazy time, it's so important to take time to take care of yourself, because you are worth taking that time for. All right. See you guys next time. Take care.